Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. My name is Paul Thomas, and with us as always is Bill Kearney of Northlake Medical Pharmacies. And Bill, how are things going as we get into a new month of the new year?
Yeah, well, lots of things. If you were covered California, you had until yesterday to sign up.
That's right, yeah.
Hopefully everybody did that. If I don't think they're going to expand that time from January 31st, but that's part of the Affordable Care Act, and they're going to do everything they can to keep people in that in the state of California, regardless of the move to repeal the Obama Affordable Care Act, which ended up not being very affordable for many and certainly costly for health care providers, putting 4.1 million people in California back on Medi-Cal. So we're eager to start a new year, and we're 1 month into it now, and we're experiencing our next storm coming up tonight, I guess.
About a week of a break there, and then this next one's supposed to come in, and they're saying 1 to 2 inches of rain again.
Yeah.
So it's been good. I mean, it
really
wet,
has,
but it's been really good.
And I guess back farther east, because I go back there for meetings all the time. I had a meeting with my CEO 2 weeks ago, or a week ago last Sunday actually, and our headquarters are in Wisconsin, and they haven't had hardly any snow there at all. It's been cold, but not much snow. So anyway, normally I have a hard time getting enough subjects. I've got so many things to talk about today. We're going to talk about drug prices, which is something we talk about almost all the time, but there's a new impetus from the president to work on drug prices. We're going to talk a little bit about that. We're going to talk about lots of times we talk about high cholesterol. We're going to talk about how to lower high triglycerides, which is one of my problems. My cholesterol's fine. My good cholesterol is good. My bad cholesterol, my good cholesterol is bad. My bad cholesterol is good. So we're going to talk about how to do that. We're going to talk about off-label drugs, where people, I know we've talked about this before also, but where physicians are prescribing medications that the Food and Drug Administration never intended to be for that use. And although it's not illegal for them to prescribe that drug for that, it's increasing. And then lifesavers for consumer health and emergency health information that you have to have within your reach, and more so now than ever before with healthcare changing. We've talked about this many times about how you have to be responsible for your own health. So hold on here. This doesn't happen very often.
Getting a little serenade coming from the pocket.
Seems like this has been more frequent lately.
Yeah, well, hey, it's a nice little easygoing tune there. I mean,
yeah. First thing we were going to talk about is drug prices, and drug makers are accused of fixing prices on insulin, which is a huge issue now. This lawsuit was filed Monday and accused 3 makers of insulin of conspiring to drive up the prices of their life-saving drugs. And it's harming patients who were being asked to pay for a growing share of their drug bills. And we find that all the time with formularies being changed and drugs being changed. The price of insulin. Now, insulin has been available for years and years and years. In fact, a lot of our listeners might not know, but Mary Tyler Moore, who just recently died, was a diabetic, and she was a type 1 diabetic, which would have been on insulin for all of her life, because in a type 1 diabetic, your pancreas does not secrete enough insulin at birth, and so you end up injecting yourself for the rest of your life, and there's no changing that. But the 3 manufacturers, Sanofi, Novo, and Eli Lilly, are raising the list prices of their products in prompting an outcry from all kinds of patient groups and doctors who pointed out that It has little to do with increased production costs. What we do see is different kinds of administration, needles, and ways to get insulin into your system. This lawsuit was filed in federal court because the companies of exploiting the opaque pricing system in a way that benefits themselves and their PBMs, which are the pharmacy benefit managers. Several examples of patients with diabetes who are unable to afford their insulin treatments, which can cost up to $900 a month, and that is not unusual. That's a typical price for some of these human insulins. People have resorted to injecting themselves with expired insulin or starving themselves to control their blood sugar. Some patients intentionally allowed themselves to slip into ketoacidosis, which is a blood syndrome that can be fatal, to get insulin from hospital emergency rooms. So this is a sad state of health affairs. A recent study in the Journal of the American Medical Association found that the price of insulin nearly tripled from 2002 to 2013, and I can promise you that is a fact. The people who have to pay for out of their pocket for insulin are paying enormous prices, which they shouldn't be. And even if they're on insurance plans, you should see what our reimbursement is on a $1,200 to $1,300 a month supply of insulin. I just ran yesterday the amount of money that we lose on test strips, and you can't, it's hard for you to believe this because we are reimbursed now $6 for a $50 strip of a test strip for many insulin companies, and we lost, with rebates from the manufacturers, over $1,300 just in one store in 6 months, over and above what it costs us. Net pricing plus rebates, we still lost that much, especially on Medicare and Medicare B, which is the place where we bill insulin and inhalants. So the Sanofi, which is one of the companies, said, "We strongly believe those allegations have no merit and will defend against their claims." Lilly said it had followed all laws to the highest ethical standards, and Novo did not immediately respond to a request for comment. So this rising cost, of course, of medications has led to several hearings in Congress and has drawn the attention of President Trump, who pledged this month to address the issue and said the industry was getting away with murder. I just this morning got an article for high prices on drugs with generic alternatives. We've talked about this company before. It's called Horizon. Demonstrates how self-serving behavior within healthcare keeps prescription medicines expensive. The product they're writing about is a prime example of how some companies have managed to skirt price and utilization constraints placed by the pharmacy benefit managers to prevent gouging. Approved by the Food and Drug Administration in 2011 and indicated primary for arthritic use, there is a drug called Duexis, which combines two over-the-counter medications costing less than $20 a month. If brought separately at the same dose as the prescriptions, which came on the market at a wholesale price, came on the market in 2011 at $158.40 cost, and that was a combination of these two drugs. A series of price hikes have inflated that price to more than 1,000% since then. It's $2,061 as of August 2016. These drug costs have skyrocketed despite controls designed to prevent such spikes, including prior authorization, step therapy requirements, higher co-payments. Pharmaceutical interests have found several ways around these hurdles. The Horizons case, it funneled Duexis prescriptions directly through an affiliated mail order specialty to ensure prior authorization. So Remember, I'm in a co-op that has 1,400 stores. I have approximately 20 stores, and I'm responsible for the western half of the United States. 20 stores that have made tons of money from special interest groups, from a company that sends everybody through email to go to specific pharmacies. Most of these are mail order pharmacies, and it has increased the generic, decreased the generic percentage for stores that have rebates, and has, of course, affected almost every pharmacy when it comes to price increases. So in December, attorney generals in 20 states accused several generic manufacturers, including Teva and Mylan, of engaging in a price-fixing scheme. Federal investigators also said to be looking at the issue of drug prices, and several companies, including Valeant Pharmaceuticals, have said they've received subpoenas. So, I don't know what to do. I spend, I don't work the counter as much anymore. I do consulting and do immunizations, and we used to do compounding, and the federal or the state government has now said we can't do compounding anymore because it's too hazardous without us spending $150,000 to build a new laboratory. But in December, Lilly said it would offer a 40% discount off the Lilly price list of Humalog, who are forced to pay full price. Novo has pledged to limit increases in the market to less than 10% a year. And if you remember, last week I talked about companies who promised to limit their increases to single-digit figures, but instead of doing it on an annual basis, they did it on a quarterly basis or a semi-annual basis. This lawsuit that was filed Monday claimed that the three companies intentionally raised the list prices on their drugs to gain favorable treatment from these pharmacy benefit managers. And I will tell you who those are. That's Express Script, United Healthcare, and CVS Caremark. And drugs will be covered on a list of approved drugs, and insurers do not pay the list prices for the drug makers. Instead, the pharmacy benefit managers negotiate a rebate that is returned to them. Now, this rebate, which was the DIR fees, that was supposed to be returned to you, the patient, or for a lower copay, or for us as the provider of that, is going back to the pharmacy benefit manager. So even though the drug companies are lowering their price in many instances, the pharmacy benefit managers are taking that money at the price that the drug manufacturers know about. So the drug manufacturers end up setting two prices for their drugs, the higher list price and the lower secret or real price that the insurers pay, and we don't know what that price is. Right now we're losing on every hydrocodone prescription that we fill, which is a narcotic. We're getting paid 6 cents a pill, and it costs us 16 cents a pill. The lawsuit claims that rather than competing with another company to lower the retail price, the real price, the drug makers are trying to offer the best payment to the pharmacy benefit manager, not the pharmacy. So when the list price goes up, many patients see their out-of-pocket costs raise even though they have health insurance, and that's because excuse me, the plans increasingly have higher deductibles. That's what we saw this year on Medicare D, and almost every manufacturer of drug products and every insurance company have raised their copay and have raised their deductibles. So the heat is on these pharmacy benefit managers, but they really don't care. The lawsuit focused on the drug makers because they're playing the game and they are the ones who publish the list price. But I really don't know what's going to happen. It's really tough to be the last individual or the last entity that gives the drug to the patient and tells them we can't afford to do their prescription anymore. Now, CVS Caremark, which is CVS Pharmacy and a division of theirs, They are one of the PBMs. They get the kickback. We don't. Several of the other companies get the kickback also, but if you're an independent pharmacy, Brian Henry, who's a spokesman for Express Scripts, who's the nation's largest pharmacy benefit manager, said rebates don't raise drug prices. Drug makers raise drug prices. So they're trying to eliminate the very people who allow them to exist. This PBM, Pharmacy Benefit Manager Group, came into being with the Affordable Care Act, and now it's just another way, excuse me, to raise prices on the consumer and to lower rebates for the pharmacies themselves. So we'll keep you. I don't know anything that's higher profile in healthcare right now than the cost of drugs, and it will eventually put independent pharmacies out of business that can't afford to take the losses. And now, as we're getting our taxes ready for April 15th, we're going through and determining where those losses are, and if we continue to fill prescriptions that we lose money on. I've had discussions with several of our patients today, up to date, talking about whether or not we can afford to fill their scripts anymore, and we have filed an appeal with AARP, with Express Scripts, with Optum RX, all of those companies, to appeal to them about how do you expect us to operate at a loss. And when you see the amount of people behind our pharmacies, how many people it takes to get that prescription filled is incredible. And at not foundation type salaries, most of those individuals, unless they've just come on, are making a decent salary. Plus, people like myself are paying 100% of their major medical insurance and giving them benefits that cost money also. Well, we said we were going to talk about lowering cholesterol, and what I meant in the end of that discussion was how to lower high triglycerides. They're the most common fat in the body. Most of the foods that people eat, whether from animal or plant sources, can have an impact on the levels of triglycerides in the blood. Excuse me for that cough that came back again last night for some reason. So before I get into that, I'm talking about that cough. I have so many people that come to me that have this cough and this flu-like symptom right now. And I had a gentleman that came in that had been on 2 different antibiotics, and he hasn't gotten any better. And I said, well, it's probably a virus, and the cough is going to stay around for a long time. So what we're recommending is a type of drug that breaks up the congestion in your chest and has a cough suppressant with it, and it's over the counter, and it does a wonderful job of trying to break up that congestion. So if you're having that cough and the cough syrups don't seem to work, this is a combination of guaifenesin and dextromethorphan that is in a tablet form. So ask us for it at the pharmacy, and we'll be more than happy to find it for you. Triglycerides. There's a whole lot of different kind of fats, and it gets kind of confusing because from polyunsaturated fats that's found in olive oil to the saturated fats in red meat, excuse me, they all contribute to triglyceride levels in the body, but they do so in different ways. So when you eat more calories than your body needs, which most of us do due to portion size and what we eat, the body stores those extra calories in the form of triglyceride fats. And then later, when the body needs more energy and you're not supplying more excess calories, it consumes those fats instead of needing more calories. And most times we just give it more calories and they don't use up those stored fats that are triglycerides. And they are important for health, but high levels of triglyceride can lead to conditions such as heart disease, and which is the leading cause of death in the United States. And taking steps to reduce those triglyceride levels and reduce other risk factors can decrease a person's chance of developing heart disease. So there's drugs like Lopid, which is a gemfibrozole, which is a triglyceride-lowering drug. You want to have a triglyceride level that's lower than 150. And if you don't know what your triglyceride levels is, when you go to your doctor's office, ask them a copy for your lab report. That belongs to you. There should be no problem in you getting a copy of it. Many times I forget to ask for it, although I do ask the physician, and then when he goes up to set an appointment or she goes up to set an appointment, they forget that we've asked for that. So there are different ways to lower that triglyceride level. Risk levels from 150 to 199. That's like saying, your diastolic pressure should be 72, and you can go up to 90 before they're really concerned. But above, from 200 to 499, anything above 500 is considered very high. And you can lower your triglyceride levels by, depends on why your levels are high in the first place, but an average individual consumes more calories than you can burn up and result in excess. And one way to lower those triglyceride levels is to reduce the number of calories ingested every day, just like we talk about to lose weight. So according to the American Heart Association, there's evidence that 5 to 10% weight loss can decrease triglyceride levels by 20%. That never happened to me. I still have, my triglyceride level is too high. If you pay attention to what you eat in order to lower the triglyceride levels, they must watch and eat plenty of fruits, vegetables, whole grains, legumes, nuts, and seeds. A diet that is good for the heart and blood also includes reducing the amount of sodium, which I have a problem with, and I'm trying to be more disciplined about that. Added sugars, which I don't do. I don't use real sugar. And what are known as solid fats in the diet, and that comes from meat, full-fat dairy products, and in some coconut and palm oil. Those drugs contain trans fats and saturated fats, and those both raise triglyceride levels. So we should try to replace them wherever we can. Unsaturated fats, especially polyunsaturated fats, actually lower triglyceride levels. Omega-3 fats found in cod liver oil and cold water fish such as salmon and sardines. Flax seeds, for example, instead of steak or hamburger, which are high in saturated fats, opt for a fillet of salmon or a tuna sandwich. Last night for dinner, I actually took a can of tuna and crushed up 3 or 4 soda crackers in it, and that's what I ate for dinner. And the night before, I actually had a trout that I'd caught a few months ago. So animal products such as lean meats, skinned poultry, fat-free or low-fat dairy, and seafood are also good options. Also limiting the amount of carbohydrates that you take to below 60% of the recommended daily calorie allowance. Diets with a carbohydrate intake above 60% are associated with a rise in triglyceride levels. So carbs are a problem for me. I probably crave carbohydrates more than I'm not a sweet eater, and I don't crave sweets. That's why sugars aren't important to me. But choosing lean burgers wrapped in lettuce instead of a high-calorie bun, desserts, fresh or frozen blueberries, blackberries, raspberries. I'm a grapefruit fan. I love berries, and so I eat those on cereal some mornings. Sometimes I just eat a bowl of strawberries or blueberries. Monday morning for breakfast, I had some Cheerios with blueberries on top, and they make a great contribution to keeping your triglycerides down. Sugars that aren't a problem for me are comes in many forms: white sugar, brown sugar, honey, corn sweetener, or fructose, fruit juice concentrate, every kind of fructose, dextrose, maltose, lactose, sucrose. Taking steps to avoid drinking added sugars. Every 4 grams of sugar is equivalent to 1 teaspoon of sugar. So the recommended maximum sugar intake for women is 24 grams or 6 teaspoons full, and men it's 9 teaspoons full. So drinks that have a high added sugar level can opt for low-calorie drinks such as tea or ice water. On a warm day, reaching for a soft drink splash of 100% fruit juice or a glass of sparkling water is a better option. Now, what do we have coming up Sunday, Paul?
The Super Bowl.
The Super Bowl.
Can't say that. The big game.
The big game.
Yes, it's trademarked.
And what happens in the big game when it comes to our diet?
We eat a lot. Do
Do.
you have a menu already set?
No, normally we have a sorority meeting at our house to have Super Bowl, and since my wife has been ill, we're not going to do that this year. We're going to a friend's place, and but everybody brings a dish.
Yeah.
Everybody brings an hors d'oeuvre dish, and then wherever we have it, they have a main thing at halftime. So, pulled pork sandwiches or hot dogs cooked in beer, or there's no salmon unless it's in cream sauce and
right.
So
I think we're going to do sliders this year. Yeah, Safeway has this deal on, and we never buy ground beef, but it was like $1.79 a pound or something crazy like that. But you had to get like this huge pack, and so we're like, well, okay, maybe we'll just use those and do little mini hamburgers, little sliders and stuff like that.
Well, I had printed out a recipe for Dana to make these little wieners, these Smokies.
Oh yeah.
And then
wrap them in bacon?
No.
Oh.
This was completely different. You pour in a cup of alcohol, bourbon, I think.
Bourbon, okay.
And then brown sugar and something else, and then you cook them in a crock pot for 3 hours slowly.
Yum, yum.
And I'm sure, you don't eat just
brown
one of
sugar
those.
Bourbon Smokies, huh?
Yeah. And there'll be macaroni and cheese, and there'll be all this thing. So,
the Super Bowl's more about the, to me anyway, these days, and we haven't had a dog in the fight in a few years.
Yeah.
The 49ers were there 4 or 5 years ago or whatever it was, and then before that, who knows how long. But it's more about getting together with people and socializing, and the people seem to watch the commercials more than they watch the actual game and the food. So it's more just an excuse to kind of get together.
We had 8 televisions in our house, and so everybody could go. If you wanted to be around a whole group of people being noisy, you had a room or two to go in. If you wanted to be by yourself, there was another room to go in. If you wanted to be with just a few people, you could go in another room. So this will be a big change for us, and it will be but speaking about the 49ers, and I hate to get off the topic here, but I want to
well, it is a health show, and those of us that are 49er fans, I'm sure our health has declined in recent years.
I want to really talk about an unfortunate incident that happened 2 days ago, and a Navy SEAL named Bill Ryan Owens, who had links to the Giants. He was a very good friend of the San Francisco Giants, and he was a very good friend of a friend of mine that's a Navy SEAL and is deployed right now. Lost his life in a raid in Yemen, and he used to stop in the Giants clubhouse with talk to Posey and a couple of the other guys about how much he loved the Giants, and he was just a great human being and a great loss to our country. And I will say that unlike the past, it was brought up by the President of the United States, and an issue of sacrifice. And our prayers and blessings go out to his family and friends. That was a hard hard thing for them to accept. So anyway, back on triglycerides that we were talking about, if your triglyceride levels are too high, the risk of certain diseases and disorders also increased. Coronary artery disease, arteriosclerosis, high cholesterol, plaque buildup in the risk of your arteries. The most common causes are diet and metabolism, and that's what we've said for years, that we need to do something to avoid those things. So it's diet and exercise, diet and exercise, diet and exercise. So people who've developed heart disease before the age of 50 are especially tolerant or at risk. Women, especially pregnant women that are taking estrogens, obese, Mexican American men and Native Americans are all in a high risk. So we've kind of gone over here for our break, so we'll take a couple minutes off and have a break, and then we'll come back to should drugs do double duty? Hey, all you weekend jocks, listen up. As we get into winter, workout plans change. Instead of playing softball and soccer, we're working out in the gym, playing basketball, or running on the treadmill. Use the RICE method to treat an injury right away, so on Monday when you go back to work, no one ever knows you aren't the macho guy you want everybody to think you are. The RICE method is rest, ice, compression, and elevation. Rest. For most injuries, rest the area until the pain decreases. Ice. Ice is the most effective treatment for reducing inflammation, pain, and swelling of injured muscles. Apply ice as soon as possible after an injury, even if you're going straight to the doctor. Compress. Between icings, wrap the injured area with an elastic bandage to help control swelling and provide support. Elevate. Raising the injured area above your heart to help reduce swelling by draining excess fluid. And at night, place a pillow under the area to support and raise it. North Lake Medical Pharmacy, with 2 locations to serve you. Hill Road next to Sutter Lakeside Hospital and outside the Bruno Shops Mart.
We live in the age of mobile devices. Cell phones, tablets, digital cameras, laptop computers, and 1,000 others. They help us get where we're going. They keep us in touch and informed. They help us work and play. And they all use rechargeable batteries, millions upon millions of them. But these batteries aren't just rechargeable, they're recyclable. Together, individuals and businesses have recycled over 70 million pounds of batteries and cell phones. A network of over 50,000 free drop-off locations across North America makes the process easy and convenient, no matter where you live. Recycling these batteries keeps them out of community landfills and also preserves their materials for use in new products. We all enjoy the freedom that mobile technology gives us. Let's accept the responsibility to pass that freedom on. Find out how recycling works, how it helps, and how you can answer the call to recycle. Visit calltorecycle.org.
On today's episode of America's Least Wanted, the home invaders most likely to threaten your family are not human. Cockroaches can spread salmonella and trigger asthma attacks. Termites destroy billions of dollars in property each year. And stinging insects send 500,000 people to emergency rooms. Learn how to protect your family. Arm yourself with the facts at pestworld.org.
A public service announcement from the National Pest Management Association.
Everybody knows that high school sports generate suspense, excitement, and drama.
They also generate higher grade point averages, stronger work habits, and greater self-esteem.
Everybody knows that high school sports give us more value for our entertainment dollar.
They also give us leaders committed to strengthening communities right here in California. The true value of playing sports in school can't be measured in wins and losses or dollars and cents. Studies show that participation in sports, along with other extracurricular activities, is one of the best ways to teach leadership, cooperation, accountability, and other invaluable life skills. Don't just stand on the sidelines. Encourage the young people you know to get in the game. When you do, you'll be helping them get ahead in life. High school sports, a winning part of a complete education. This message presented by the California Interscholastic Federation and the California State Athletic Directors Association.
Alrighty, we're back.
Okay, this thing that we're talking about has risen to the height again about off-label use and should drugs do double duty. Your doctor might give you a drug for a condition that's not approved to treat. It may be a risk you're not ready to take. Your doctor might prescribe a blood pressure drug like generic propranolol to calm you. You can't sleep. The doctor may give you trazodone, which is an antidepressant, but it's often used for insomnia. Drugs that are prescribed by doctors that are off-label, that is for conditions not approved by the FDA for any use they see fit, and most don't tell their patients, and the results have been kind of alarming. A recent analysis in the Journal of Internal Medicine reviewed that more than 80% of off-label prescribing by doctors lacked strong generic or scientific evidence, and patients were 54% more likely to experience some trauma by it. Many doctors don't even realize that it's not approved for the condition they're prescribing it for. For example, the example they use for propranolol, that's a beta blocker. It's used for high blood pressure, but it's also been used for stage fright, for a reason for essential tremors for people that have tremors. Doctors had been forbidden to promote drugs to consumers and doctors for non-FDA approved use since 1962, and that's when Congress strengthened our agency's regulatory power over thalidomide, that a lot of you may not know, but it was a drug that was used given to pregnant women to treat morning sickness, and it led to birth defects. But the rules prohibiting advertising on TV and magazines and elsewhere for unapproved off-label uses could soon change. Last November, the agency had a 2-day hearing to gather input on whether to give drug and medical device companies more leeway in promoting off-label uses. The pharmaceutical industry, of course, is lobbying to lift the off-label label marketing ban. Relaxing the current rules would dismantle a legal firewall. It doesn't even seem to me like there's a firewall now. If you want to prescribe something that's off-label, you can. It isn't illegal. It's illegal to promote it for that use, but off-label prescribing makes sense in a lot of situations. On occasion, a new use for a drug may be supported by good evidence. A recent review found strong evidence that using anti-seizure drug topiramate was helpful in treating alcohol dependence. Catapress, which is a drug for high blood pressure, one of the older drugs that was used for high blood pressure, has been very effective in treating addicts to get them off heroin. Amitriptyline, which is an antidepressant called a tricyclic, has even been recognized by the American College of Rheumatology as therapy for fibromyalgia. And you will see many people that are being treated for chronic pain, they will add a tricyclic like amitriptyline to a opiate drug and also to a non-steroidal anti-inflammatory. So for practical reasons, a drug may be given off-label to children, pregnant women, or even elderly, although its effectiveness hasn't been studied in those groups. Right now, we see a huge increase in people taking Benadryl, diphenhydramine, for sleeping. You can take, there was a report out just a couple of days ago about, in one of my professional journals, about people taking doxylamine and some other over-the-counter drugs that have been harmful to people even though they're over-the-counter, for a sleeping aid. And diphenhydramine, which is Benadryl, you can buy it for over-the-counter, and 25 milligrams for relatively inexpensive. And we have talked about that drug in the past of causing an accelerated form of dementia if you take as little as 12.5 milligrams. This study came from England at the time. But many seniors, because of the discrepancy from the Beers criteria. It's a criteria for elderly people, especially if they're in a skilled nursing facility, and it's anticholinergic, that meaning something that slows down and can cause you to have higher pressure in your eyes, can cause your saliva to decrease, it can cause you to have some constipation. It's an antihistamine. Benadryl and chlorpheniramine were antihistamines that were used for years and years and years before Claritin and some of the other drugs that came out that were non-sedating. And it is now being an accelerated use of people that are that can't sleep. NyQuil or NyQuil sleep aid is diphenhydramine, is Benadryl. You pay a lot more for it in the liquid form because it's made by Vicks, and then you can buy it generically also, but that's all it is. It's just diphenhydramine. So practical reasons for doing that, the use of antipsychotic drugs like Abilify and Seroquel, both are approved to treat schizophrenia, but may be given off-label to people in nursing homes who suffer from dementia as a way to control agitation. These drugs are powerful drugs. Abilify and Seroquel actually affect the way you think. It changes your brain pattern. They're called atypical antipsychotics. Risperidol and Haldol were the drugs prior to those that were used, and we would find people in nursing homes being sedated so much with those that they would just sit in a nursing home. This was many, many years ago, and the way to handle them was just to keep them sedated with those drugs. Analysis from the Food and Drug Administration said that this off-label use ups the risk of death, most often from heart failure or an infection like pneumonia. They've warned doctors about this practice, but there's no legal reason that they can't use those. So the U.S. healthcare system evolves to become increasingly focused on value. Patients, payers and providers all seek safety and effectiveness. When I was doing the 4 nursing homes, or 3 nursing homes in the county, I was writing up whenever they would use those drugs for those purposes because of the Beers criteria, and I would send that report to a physician on a daily basis. Now, you can't really argue with the physicians too much because they only see those patients maybe once a month, maybe once a week, and they react to what goes on in the nursing home as far as behavior. And then they don't come back. I think our biggest problem was when people were using inhalers and they weren't using them properly, and then the doctor would come back after a month and say, well, then let's increase the dose or let's add another inhaler. So there's ads targeting consumers about benefits and risks that can be particularly misleading. They can also overstate the benefits from using this. So when off-label promotions are illegal, one reason drug companies may want more freedom to market or advertise those is to eliminate the financial penalties for off-label promotions. Johnson & Johnson in 2013 agreed to pay more than $2.2 billion to resolve changes that it illegally promoted several drugs, including Risperidol, approved by people with schizophrenia, which was also marketed to doctors for off-label use for older adults with dementia, children, and people with developmental disabilities. Right now, I can tell you ADHD patients that are children have responded to antidepressants, autistic kids, to blood pressure medications that have been effective in combination with other drugs. In 4 years ago, GlaxoSmithKline paid a record of $3 billion and pleaded guilty to promoting Paxil to off-label to treat depression in children and adolescents, which is an unapproved use. It will tell you right on the label that you dispense on, this is not to be dispensed to children. And it didn't work. It failed to demonstrate efficacy in patients under the age of 18. and was linked to dangerous side effects, including an increased risk of suicidal thoughts and behavior. They've changed a lot of those warnings now on antidepressants of causing, and one of the drugs it changed wasn't an antidepressant, was Chantix, which they use for people to stop smoking. They found out that the suicidal effects that was caused by a lot of the people taking these drugs was had already begun, or in the Chantix thing, it was because the fact that they were withdrawing from the tobacco that they were becoming suicidal, not because the drug had anything to do with it. So if you can market a drug off-label for a condition, then why spend all the time and money on testing it? They worry that relaxing restrictions, in fact, will increase the level, and that's actually a thing that could easily happen, and I don't even know why they would do that. If it's an off-label use, ask whether there's a good reason and good research that support using it for that condition. But what we find is that doctors, for example, when they give you trazodone, they will call and say, why did I get this drug? I asked for a sleeping pill, and this is an antidepressant. And then, well, I will explain, of all the antidepressants, trazodone is the most sedative of all the antidepressants. So that's why it's prescribed. Klonopin is used, it's approved actually for seizures and panic disorder, but it's very effective for RLS, restless leg syndrome, and insomnia. But it does pose a risk of birth defects. Trazodone, we just talked about, says it increases suicidal thinking in children, teens, and young adults. It was never designed to be used in children, teens, and young adults. Seroquel was designed for schizophrenia or bipolar. It offers little hope in controlling agitation in elder people with dementia, and that's what it's being used for. The propranolol we talked about was for high blood pressure, but as we spoke about, it's used for stage fright, for essential tremoring. Some of the side effects is it causes dry mouth, but it doesn't stop fearful thoughts. For last November, in an urge to urge the Food and Drug Administration to stop trying to increase the use of off-label prescribing, a Consumers Report started the results of the survey of more than 1,000 adults, and it revealed that the most respondents didn't want drug companies to advertise medications for off-label uses. If I had my way, they wouldn't advertise drugs at all on television, on radio, in print, in magazines.
But Bill, if they didn't do that, what would fill a magazine? Because you buy magazines these days, and it's just all drug ads.
I know, and I've been to 3-4 hospitals in the last 2 weeks, and in the waiting room, there's magazines, even like People magazine, and
all of them.
All of those are filled with a full-page colored ads of medications that they should, and a lot of these are the off-label medications. Now, they don't say specifically, they can't say to be used for that purpose, but they are. And in the very fine print at the end, or when you hear one on television, they'll say, can cause heart damage, fatal, if you do this, you do that, and it'll happen.
Yeah, all the side effects.
You can't, the guy that's is speed reading as fast as he can, he doesn't realize. And I think I told you, Paul, about there's one that's advertised for cancer, and if you look at the fine print, it said may increase your lifespan up to 3 weeks. And it costs thousands of dollars for this drug.
Well,
and it shows the grandpa out there, having
having
a
a good
wonderful time going fishing, doing all this kind of thing, and smiling because he has 3 weeks left to live. And that disturbs me because, especially because the cost of medications and how essential it is for us to try to make these medications affordable, and then ask somebody to spend their life savings on a drug that maybe will give them 3 weeks to 3 months more of lifespan. I'd rather go out and buy a Cadillac or an expensive car and just not pay it off and use it for 3 months.
There you go.
I shouldn't say that, but it's capitalizing on our elderly a lot. And a lot of people, like we were just talking about with insulin, people are starving themselves to go into ketoacidosis so they can go in the hospital and get insulin. They are going into a diabetic coma. They are using outdated drugs. There's something wrong with our health system, and this using off-label drugs in many cases can be an adjunct to helping you, but it also become a nemesis as we talk about speed limits on roads. On maybe I-5, you should feel like you could go 80 miles an hour, and many people do. But if you didn't have a speed limit, it would be people doing that all the time, and there would be more deaths. And rules and regulations are made for people that abuse those things if you don't put a law in there that says you can't do it. You will see how widespread marijuana use is going to be in this county now that California has said, go ahead, recreational is fine. Everything medicinal is fine. We don't care whether it's medicinal or recreational. We'll approve it because we need the money. And I don't know. Sad state of health affairs. But I want to remind you that we have still giving immunizations. I just heard a blurb on national news saying if the flu is rampant right now, and if you haven't got your flu shot, get it. We can't get flu vaccine anymore. In fact, the manufacturers asked us to send back what we had left. We didn't have any left. We are telling people to try to go to the health department on Bevins and see if they will give you a flu shot. It has been 79% effective in this kind of flu, and you wouldn't think about it by the number of people that have come in that are very, very sick. And we had our first death in Lake County last week for somebody that had the flu. I'd like to remind you we're North Lake Medical Pharmacies with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard, call us there at 263-1328. And come in and get your children's free vitamins and talk to us about that free vitamin plan. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday at 10 a.m. for Health Talk right here on AM 1270 and 96.5 FM KXBX Lakeport.